I've never, well, I say never, I've done this a few times, very rarely. Call it what you want. Social media video, I do it very rarely. Normally take pictures of food, rant on Twitter, retweet, favourite, talk about me. But I hardly do videos because I don't like being on video anyway, ever since I was a child. But I feel I have to do this one because it's been a rough 4 or 5 weeks, mentally and physically. Those that know me, family, very, very tiny amount of family, like my mum's husband, my boyfriend and carer of 11 years, and anyone that follows me on social media, and my past doctors in London, Dr. Tomlinson at the Lawson Practice, from 2010 to just after the 13th of June 2016. My other GP in London, the Wiston Road Surgery, Dr. R.P. Talani, from 1984 to 2009. If anyone's been following me, I just moved to Bedford, handed over my tenancy to my mum. My boyfriend bought this big place. We have a couple of tenants. We bought 2 dogs from Dorset in mid-June, and I'd registered for a GP locally, and my first appointment with her was at the Pemberley surgery in Bedford, and it was on the 25th of July 2016, and because I'm not very good at filling out forms and my penmanship's a bit all over the place, I sent a 4-page type letter to give her a bit of history. The GP said she found this helpful when I saw her in July. I asked for some blood tests because I haven't been feeling well. Urine problems and a very foul smell of urine that comes and goes with bladder pain and the urgency of to go to the go pee all the time, even though you know you've emptied your bladder. And that's been getting slowly worse over the last, whatever it was then, it's now 9 to 12 months. I had a high blood sugar test for diabetes, then they put me on a fasting one. Apparently that came back normal. She told me, this was on the 8th of September now, sorry, I'm jumping into the future. She told me this on the 8th of September 2016, obviously, that all the blood tests had come back pretty much fine. No diabetes, great iron, no kidney, liver problems. But then she said I had high cholesterol, too much of the high, and not enough of good fats. Then she printed off this diet sheet. She mentioned statins for a second. So you get this weird system, 10 minutes or less, or 2 topics per appointment. So on the 19th of September, I went to see her to discuss, because I got urine tests done on the 8th of September, and she was meant to send me to urology. Then I found out on the 19th of September that 11 days later, she said, oh, I forgot I hadn't sent you away for a urology test. It's like great, because the bladder problem's been a great problem. Quite painful as well. And it's probably being masked by my other pain drugs for other stuff. I was there for 2 different appointments. I was meant to be there for 10:30 to 10:40, and that was about seeing a hand surgeon in London about the results of my operation this May. Then it was about to continue my pain jabs in London, but have local physiotherapy or pain management physiotherapy that offer mirror therapy and advice on TENS machines, because I couldn't afford to keep going to London locally, and I'm living in Bedford now. And she said, no, you can't have both, you can only have one or the other. Too many chefs in one thing. I said, no, it's continued, as in it would go from London physiotherapy to Bedford physiotherapy, they would continue the treatment of physiotherapy or mirror therapy and changing. And she said, oh, I know nothing about mirror therapy, I don't even get help. I said, my case is complex, you don't really need to understand that. Then I said, oh, I've got another appointment, I believe, at 11:20 to 11:30, and I'll see you in an hour or less. And she went, oh, one of my patients has been late, I shall see you now. I said, okay, but it's quite a complicated history again. I said, I saw someone in Hackney Mind in 2007/2008. She was helping me with my disability living allowance application form. It was either my second or third, I can't remember off the top of my head. While she was doing this, it took like 2 weeks or a day or an hour, a couple of hours, whatever it was. It's a long time ago, we're talking about 07/08. She said, oh, I've seen other patients like you with similar mental health problems, needing appointments or travelling on buses, blah, blah, blah. She said, do you mind if I put in an application for a disabled person's freedom pass? She said, there's automatic rights, which you don't get, and then there's several sections. So I said, no problem. She put it in. My doctor at the time, or East London Foundation Trust, I don't know who signed it over, put down what all my conditions were. Then it was up to Hackney Council to decide whether I had it. This was renewed 3 times. I think you get it 2 or 5 years at a pop. As I moved to Bedford, my new renewal that was renewed this year in 2016, just after Christmas, beginning of New Year, my GP filled it in. I have no idea what he said. It was sent in, approved from 2016 to 2021. So I said, look, there is no national disabled person freedom pass transfer scheme in the UK. So if you move borough councils, move from one part of England to blah blah to another part of England, there's no transfer. So you have to cancel that one and put in a new application. And I'd sent her a letter in advance from the 8th of September, and I asked if she could help me with this. And I was being reasonable. I showed her the 2 passes. I had the 2016 one, which came from obviously 2011, and I had the 2016 to 2021 one that had been approved. It's cancelled as soon as I left Hackney, which was just after the 13th of June 2016. She then said, oh, you don't meet the requirements. I said, no, I don't meet automatic requirements, but there's something called A to G, and I'd only learned last year in December that it was called a fitness to drive criteria. Right over my head, no idea what that means. And then she just turned around and went, well, you don't suffer any serious mental health problems like moderate to severe clinical depression. And I'm just going, I struggled with that for the past 13 to 14 years and still struggling with now. Then she said, oh, but you don't even have anything like bipolar disorder, which is one of the requirements for the pass. I said, I never said I did, and I've never been tested for it. I then told her, oh, there's also a personality disorder requirements for these passes. And I have moderate to severe depression. I've had a clinical diagnosis of this. I said, I've got borderline personality disorder. And she went, oh, borderline personality disorder isn't that serious. And again, I was like, oh my God, what is wrong with a salaried GP? And then I was being calm for ages. I was showing her the 2 freedom pass. Approvals. I don't know if you can see that, because of course I've never done stuff like this very well, but you can read that says 2021 backwards, and I've got the other one, 2016 from 2011. I showed her a Hackney letter as well, and then she said, look, you don't have any serious problems like moderate to severe clinical depression. You have no evidence of past or current suicidal thoughts or attempts. I was just going, She said, borderline personality disorder isn't that serious. Now, I've only been dumped with borderline personality disorder from 2013. And it was dumped on me when I was put in a special group called Mentalised Based Therapy. Then I asked my consultant, have I got this? And I looked at it and went, I agree, probably got it. But it's news to me. I don't know how serious borderline personality disorder is in the psychiatric, medical, mental health world. but it's often linked with other things like borderline personality disorder. It's often linked with bipolar disorder. Moderate severe clinical depression. And I was explaining this. Then I said there's also requirements on this fitness to drive thing that if any of your drugs make you drowsy, sleepy, or you've passed out in like a sofa or the floor, you could pass out in a car, couldn't you? And boom, gone. And I said I'm on Butran's pain patches, although she changed it to Butec pain patches that come from Cambridgeshire. So it's like original Coca-Cola to a really cheap Coca-Cola in, let's say, I don't know, Tesco or something. Anyway, that's just me going on. But then I said I'm pregabalin, which is a neuropathic pain drug. I said I'm on between 6, 8 or 10 Tylex, which is 30 milligrams of codeine and 500 milligrams of paracetamol per tablet. Tylex make me drowsy, also known as Coca-Cola. I know the pain patches make me drowsy. I also know that antidepressants make me drowsy. Cipralex escitalopram at 40 milligrams, and the recommended British Medical Association guidelines is 20 milligrams. It's been approved by past psychiatrists at Hospital Hospital, blah blah blah. So I'm being calm for ages. Apparently I stamped my feet. I don't remember doing this. And I said, well, I'll show you some mental health depression, and I just kind of flipped, and I had a blackout, and I went for the chair right-handed, and I tried to smash up the chair. She went, no, you can't do this. These are my picture frames. So then I ran to another chair. I'm not proud of this. This is what I did. Ran to another chair, tried to smash it, couldn't smash it. Went outside. She'd run away through two double doors by then. Single double doors, but run through. Then this white man in his 40s or 50s, that was a GP, came out. And I went, do you want to see my mental health? And I tried to break a picture frame in his office while he was breaking it. While he was locking it, with his foot. And I tried to break the picture frame. Didn't touch any staff. So I pick up one fire extinguisher. And just throw it. Another one, there's loads of people now listening, talking, watching. So I get the fire extinguisher to smash this fire alarm straight off the wall, which I do. And as I'm doing that, an off-duty police officer, female in her 30s and 40s, blonde hair, says, don't do that. And I smashed it off the wall, and I said, I want everyone kind of away from me, blah, blah, blah. I swore at the doctor I called her a bitch and know nothing about my mental health after 3 appointments, which is true, she didn't. She didn't take anything seriously. And I explained that it wasn't up to her to decide whether I should get the Disabled Freedom Bus Pass from Bedford Local Council. It was for her to put in my notes what the patient says. They then decide. If they can't decide, then they refer it again back to the GP. She wouldn't discuss it with colleagues, anything like that. She said, oh, I'm not going to talk about this. I'm not interested. I have other patients that are on higher pain drugs. I was like, complex regional pain syndrome is the most painful thing on the planet that anyone knows of at the moment. More painful than childbirth, more painful than drilling in your foot or treading on a nail, more painful than fractures. So I was like, oh my god. And the reason I've not rushed my pain patches up to the highest is because when I got this condition, I was 18 years old, now 32. Let's say without suicide and accidents or stress-related stuff, or cancer or HIV, which is unlikely to get any of those, I could probably live till I'm 80 or 90. Now, I slowly want to increase it, so I was on 5 milligrams per hour in 2009, and then it was increased to 10 milligrams per hour in 2013. I have approval to go to 15 milligrams per hour pain patch and 20 milligrams per hour pain patch, with approval of the GP, but it's been pre-approved by the pain specialist. I haven't rushed into this. And so basically now I have a criminal record, conditional caution, have to pay back the criminal damage of £409.29 by the 30th of March 2017, which is fine, I take responsibility for that and everything, but the GP surgery at Pemberley surgery needs to take responsibility that this doctor had no empathy, no patience, and no awareness of any conditions, and I just flipped and I broke down, and I remember kind of like blacking out, and I have no idea if this is going to fit on YouTube, and I've never done editing, I don't have editing software, so I'm going to cut it off because I think you only have 15 minutes. Alright then.